folks, everybody. I'm going to call to order the meeting for Monday, November 20th of the Board of Health. And we'll start the meeting with the Pledge of Allegiance. Everybody please rise. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And a good Thanksgiving week to everyone. Welcome to the November 20th board meeting for the Board of Health. We have a quorum. We are at 5, and we are expecting at some point this coming soon to get a 9th member. We are still short a member, so if anybody in the community is interested in serving on the Board of Health who has some interest in public health, please contact the Township. I think it's on the website. There's an announcement for openings for different boards. We'll start the meeting with review and approval of the October meeting minutes. I believe they were sent out through email. Okay, and I think there's a copy for everybody here today. I did review things, and everything looked pretty square to me. Anybody have any issues, changes for the minutes? None? None being heard, then anybody have a motion for approval? So moved. All those in favor of approval of the October 16th, 17 minutes, please say aye. Aye. And any nays? None. They will be approved and put on the website then. Thank you. I think I have to do that, right? All right. And then we'll move on to the health officer's report, please. I believe who's giving that today, Marie or Kat?
Me, Marie.
Marie.
Good
Thanks,
evening.
Marie.
So just a little background here. We have currently about 211 licensed facilities. In the last month, we completed 34 food safety inspections. That can include an annual, a follow-up. We've been out for food safety training with some of the managers and, opening a new restaurant. Cornerstone Cheese now operating with a liquor license, and they expanded their seating. Rosie's Mug in Villanova closed their doors. And we had one closure due to unsanitary conditions, and that was the deli at Radnor Court. But they reopened the next day after a thorough cleaning. We had one temporary event. It was St. David's Fair. We inspected the food storage areas. They had a huge portable refrigerator and freezer we inspected. We inspected all their cooking equipment, their food prep, and their selling stations. We have 7 facilities with indoor pools that require monthly inspections, so we completed about 15 indoor pool inspections. There were 19 public health complaints that came into the department. Each of those calls require several callbacks. Most require at least one site visit, or in some cases, multiple calls and site visits. I listed a few of the concerns that came up. We had a workplace safety meeting. No work-related accidents reported for October. We inspected the Radnor Activity Center for possible hazards or safety violations. Only minor storage issues were noted. Kate and I actually attended a 2-day conference in Bethlehem for the local health department. It was pretty interesting. And then we have been fortunate to have one of the staff from the Pennsylvania Department of Agriculture actually come down and train with Kate and I over the last few months. So it's been a great experience. And in conclusion, I emailed the health alerts and the wellness observances. Thank you.
Thanks so much. Obviously, this is a tremendous amount of work the health officers do in this township, and prior to you two coming in, boy, Larry certainly had a lot on his plate, and just looking at these, all the events that you guys have to attend, and the number of facilities in a small township is pretty impressive with all the work that goes into it. Thank you for keeping us as citizens in this community safe with food safety. We appreciate it. We'll move on to some old business, just so everybody's aware. Last month, we did, as a board, approve the backyard chicken formal recommendation sent to the commissioners, and I did send a formal letter to the commissioners with that statement, and did receive some responses back that it will be brought up at a meeting. I don't believe it was yet. I wrote, "Dear Commissioners, please find attached the October 16, 2017 unanimous recommendation from the Board of Health regarding home chicken coops, and it has been drafted with scientific evidence, a thorough exploration of policy in townships across the country, and customized for our township. Although we have presented your board with a general list of recommendations for the safe and respectful raising of chickens through the Codes and Appeals Board and other bodies, it may be necessary to adjust this. We continue to be available for questions and clarification as you consider this legislation, and a special thanks goes to Dr. Joan Capuzzi for her work on this document. So they had responded to that and said that it will be discussed.
Did they give a time frame?
They did not.
Okay.
I think they've had their plate kind of full in the last couple of months, so we will hopefully get that on the board, on the agenda soon. We had spoken a number of times in the past about our teen sleep program, teen sleep issues, I should say. We did have a lecture or two on this and had some community members offer their input on this. The school board emailed, I believe, most people. Oh man, all my emails got cut off. I'm sorry. The school board did email, I think, a number, or hopefully everybody in the community, about taking a sleep survey, and this was from the superintendent, and there was a survey application online. I'll see if I can give this to the township and get this on the website if people didn't get the email. But there is a survey for parents to give their input on how they look at the sleep issues with our teens in the community. Let's see. And I believe, Ms. Shane, you guys, and you and Officer Block gave a presentation at VFMA this month?
Yes. Superintendent Block and I gave a opioid presentation to the Valley Forge Military Academy regarding opioids, and it was similar to what we did, I guess, about a year ago, so it was very well received. The Valley Forge Military Academy hosted, I guess, faculty from across the country, different military academies, so it was probably about 20 faculty there, so it was well received.
Was that a conference they were having there at that time or something like that?
No, it was, I guess, an educational conference where they look at other curriculums and get ideas for their curriculums at their respective schools.
Mm-hmm. And just looking over your shoulder here, I see that Bryn Mawr Hospital had a recent conference this month on medical marijuana.
Yes,
Speaking
so
of old business.
the Bryn Mawr Hospital had a departmental collaboration conference looking at medical marijuana, the good, bad, and the unknown in the future. So really looked at looking at risk factors associated with medical marijuana, identified recent advances and developments on medical marijuana, and their application to clinical practices, and then looked at best practices for interdisciplinary teamwork to improve patient outcomes. So it was a very interesting, it was a packed conference, so everybody's interested in what's going to happen in Pennsylvania regarding this, so it was well received, and I thought I would give it to you because we had some discussion regarding this in the past. And this professor was from Jefferson University.
Excellent. Yeah, I mean, last month we spoke a bit about the legislation in the state, and I believe it's January 1st that the program is supposed to begin. I know the application process went out for patients, and there was a lot of applications in the first couple of months, the first couple of weeks, and they were very pleased with the number of applications. And I think in the future, in the next either January, February, or March meeting, I think we're going to collaborate on this board and discuss a little bit more about the science behind, the science is out there, I should say, that's behind medical marijuana, its uses and its risks. So we'll go into that portion of the public health a little further later in this year. So stay tuned. All right. New business, I just do ask anybody who has any interest in doing a presentation for January, February, or March to please email me again this month and let me know what you might be interested in presenting for about 5 minutes. We do have this month a presentation on crumb rubber turf fields. We have probably either January or February. I'm going to try to get Dr. Offit in to speak a little bit about Teen Health Week, which is now in March of 2018, not January, so we have some time to work on that. And so if anybody has any great ideas for the next couple of months, I'm happy to take some volunteers for that. If yeah, I was going to say let's do that next. We'll introduce our new students. Could you guys help us out with that? Thanks.
So we were fortunate enough to get 7 applicants for the Board of Health interns from Radnor High School, and 2 of which wanted to come back from last year, so they obviously enjoyed the internship. But we wanted to select 2 new people, and we were excited that we selected Emily Chen and Julia Shi to the board. So we're very excited they will be with us. And I just wanted to give a little background about Emily. Emily, do you want to just raise your hand? Okay. So Emily, little background is during her, reason why she wanted to be on the Board of Health is during her sophomore year, she started Operation Smile Club, which fundraises and spreads awareness for International Medical Cleft Palate Organization, Operation Smile. She is also president of the peer tutoring at Radnor and the Radnor Society for Childhood Cancer Awareness. She participates in Model UN and is the section editor for the Radnor Beat section of the Radnor, what is that? Pardon me? Okay. Radnor, right, school newspaper. Okay, outside of school, she started a charity with her older sister called the Connie and Emily Helping Hands Incorporated with the general philanthropy goal. She also volunteers at Mainline Health Home Care and Hospice and at the Komen, and what is that, the Komen Academic Center helping children with reading and math. So welcome, we're really excited. Your letter was outstanding, so it stood above and beyond, and we were really thrilled that you applied and you've been accepted.
Okay, and it's my great pleasure to introduce Julia Shee. Will you wave? Yep. Thank you. Julia is a Radnor High School student in the class of 2019. She is vice president of the Student Helping Students Club and is active in Radnor's Sexuality and Gender Alliance. She's a member of the Radnor Physics Olympics and Battle of the Books team, and she's a student ambassador. She also volunteers at Mainline Home Care and Hospice. She has a number of honors in music. She is a pianist. She has played at Carnegie Hall. She also has awards in German, and she has an award for writing. She told me that she anticipates pursuing a career in medicine, but not sure what right now. It's okay, you're a junior in high school. Thank you so much for applying. When Mrs. Johnny and I met to review the applications, your two jumped out at us immediately. Thank you.
Thank you so much. And just a couple of things just to kind of let you guys know. This is a pretty flexible position, and we like you at our meetings, obviously. We are excited to have students and some input from you folks about lots of issues that we always discuss. They include, everything from sleep to, nutrition, health, all the kind of things that we're interested in students in our community commenting on. Another part of the position, I'm sure you heard, is that we do like our students to think about some kind of presentation they want to make by the end of the year. It could be a speech and with a little PowerPoint for 5 or 7 minutes or something. It could be, some kind of handout to your fellow students about health or public health. And your creativity is the limit on these kind of things. We will be helping you with that kind of project as a board. In addition, we thought there's a few more things that might be helpful for you guys to get some experience in public health. One would be if you're interested in speaking with any of the board members, either shadowing us in our positions in the job world, or just want to hear about what we do for a living in the field of healthcare. You're welcome to speak with us and talk to us. We also would like your input in trying to raise awareness for an annual event that we've been, as a board, been working on for the past few years, which is called Teen Health Week. Last year it was in January, so it was a little bit tight getting things together, but we have a few extra months this year because it's in March. So we'd like you guys to help us out with that as well, and sort of be the youth for us old people to help us, the good way to spread the word via social media or other means. And I thought it would be not a bad idea to start some kind of Instagram account or something, which one of us would set up and you would have passwords to update fellow students on the events that happen that week. It's a 5-day event where there's different themes for each day for teen health in general. So those are the kind of things that we're looking for the year. We want you to feel free, like I said, to ask questions, participate, give us ideas. We're always happy to have nice young students to help us out. So thank you for applying. Welcome. So we will move on to some more business. I forgot to mention one thing in old business, and we're actually coming up this this presentation we're having today is a kind of an update on older business as well, so I'll just mention this one real quickly before we have Ms. Hopko start on her presentation. We had, for the past few years, have been discussing with the township the use of a product called glyphosate. It is also known as Roundup, and it's used to eradicate weeds in our public places in the township. There had been some contradictory literature about whether it was safe or not for humans, and we did a pretty intense report a few years ago just based upon some of the national information that was out there, and as of yet, there's not any information that's too worrisome about the product. However, there are many groups of people who have doubts that the literature is completely correct. So just to keep everybody updated, every time a new article comes out or I find something in the literature, I do bring it up again. Although when we did review the large amount of studies that have been done on the product, there hasn't been a lot of evidence that it has human implications. There have been some reports of some wildlife that has been affected by the product's runoff and things, but not anything significant for humans. But just to let us know that there is an update from California, Southern California. The Journal of American Medical Association had an article that it tracked people's urine samples during 1993 through 1996, and then again from 2014 to 2016. And these are people over 50, I believe. Yes, over the age of 50 in Southern California. And there was a 500% increase in the amount of glyphosate found in the urine of these folks. What that means is unclear as far as the health effects. However, it is showing that this chemical is in the environment. It is used universally by farmers to prevent weed growth and to help crops, to make their crops more productive. So as we, I guess in the future, as we get more science behind this and there's more biomedical literature about this product, we will see if this market increase in the samples of urine has any health consequences. So I will try to keep my eye on literature and keep folks up to date. Our township, by the way, did move to start using a lot more natural products when we started this presentation, and I believe the last time that the department that, I can't remember the name of the department that does the weeds and things, they were using a concentrated vinegar solution and some other things instead of glyphosate for a lot of the parks that our children play in and our dogs play in. So, that being said, we'll move on to some more new business today, which will be a crumb rubber turf field update. Crumb rubber update from Mrs. Hopko. Thank you.
Okay. Thank you. Okay, we last examined this issue in February of 2016. And the problem is that synthetic turf and artificial turf is often composed of crumb rubber, which consists mainly of recycled tires. Tires contain a host of hazardous chemicals and heavy metals. These carbon compounds identified, lead, zinc, chromium, etc. Paint is often a lead chromate base. And players are exposed to the compounds when they play on the fields through their skin, through respiration, and through digestive pathways. They ingest tiny particles. Now, back at that time, we anticipated that by now we would have some definitive answers. The EPA and the CDC and some other federal agencies were collaborating on a study, and we were supposed to have those results now. However, I can tell you that I have hounded the EPA by phone and by email for the last 6 weeks, and I haven't heard back at all from them in any way, shape, or form. We do know there have been changes in priorities in our federal agencies, and there's radio silence about this issue as far as I could tell. I also, examined their website, and I wasn't able to find any updates. So I did a review of a limited amount of research since spring of 2016 within PubMed. I found one study by Peterson et al., 2017, a meta-analysis of chemical composition of recycled rubber and air quality on or near turf fields. The estimated non-cancer and cancer risks were within EPA guidelines, and the cancer risks for synthetic turf fields seem to be comparable or lower than natural soil fields, according to this article. The Connecticut Department of Public Health in 2016 has reported that they still believe we have some uncertainty around these issues. The advantage of the artificial turf is that athletes are not exposed to pesticides, such as the chemical that we just discussed in the prior agenda item, but exposure to PAHs and VOCs happens when people ingest small amounts, breathe in small particles, and have direct skin contact. The New York State Department of Health in 2017 has identified concerns from artificial turf use, including heat stress. The surface doesn't breathe and it absorbs heat, and so players are playing on a hotter surface than they would if it were grass. And so we need to be sure that athletes playing on artificial turf are well hydrated and seek relief in the shade. They found no pattern regarding the risk of injury by type of turf, though there seem to be more abrasions on synthetic turf than on grass. The infection risk has not been studied systematically, and so no definitive statements can be made. I will note, ironically, that just after I sent these slides to Dr. Foreman, I heard a discussion on NPR about parents being concerned that their children are exposed to too many microbes when they play on natural fields. But whatever, I mean, you can't win, right? Latex allergy has not been associated with artificial turf. The California EPA and the Norwegian Institute of Public Health have both found low risk to children from the ingestion of crumb rubber. The French National Institute for Industrial Environment and Risks finds that inhaled vapors have not contributed to health risk. The CDC and the Agency for Toxic Substances and Disease Registry acknowledges the potential for lead exposure and recommend artificial turf products that do not have elevated lead levels. So in summary, currently the New York State Department of Health believes that synthetic turf does not pose a health risk. Cornell University has a sports field management program, and they, in 2017, posted investing in safe fields. So if you're going to go with natural turf, they want you to make sure that there are no bald spots, because bald spots are associated with athletic slipping, falling, and injuries, ankle injuries. The turf is also supposed to provide a cushion. Again, avoiding pesticides is a priority, and rotating the turf fields to allow for rest and recuperation of the grass cover is something that the Cornell folks recommend. So I have, oops, I thought I gave all the references, including the websites, but I'll make sure to send you guys the complete references, and then you can post it after I send it. Okay? Thank you. Any questions?
What's the prevalence of these fields in the U.S., these turf?
The turf fields?
Yeah, the crumb rubber.
The crumb rubber
excuse
turf,
me, yeah.
they kind of took over in the 80s
Okay.
and 90s because people were concerned about, well, the cost of maintenance of natural grass fields and the exposure to the chemicals used to maintain natural grass fields, pesticides, herbicides. So now I can tell you that there's a, at University of Massachusetts at Worcester is famous for its study on risky products. And so they have a big investment in studying the use of crumb rubber fields. They didn't have any additional information than what I shared with you, but what I can say is that the town that they're in is one of the towns that has now gone on record as being all natural athletic fields, and that's a decision that only happened in the last couple of years. So I would say that probably most It's
Throughout the
probably
country?
majority, yeah, around the
Okay.
country.
All right,
And ours are about 20 years old. I think we learned the last time we were together on this topic.
okay. And is there any, have they looked at safety varying with the size of the particles? Because I'm sure some of them are, larger particles, and, crumb.
I didn't see
and some
any-
are smaller, I don't know.
I didn't see any literature that specifically looked at the size of particles, but when we reviewed this topic in February of 2016, we knew that older fields were the problem, that new ones aren't falling apart like old ones that have been out oxidizing for
Right,
decades.
and
are.
vaporizing, I guess.
Yeah.
This is great, Nancy.
Okay, I wish I had an answer, but
Question. Any evidence, do you see any evidence that with the crumb rubber field, the athletes are more prone to get twisted ankles, twisted knees?
yes. So that was one of the slides that I shared with you, that there's not any significant difference in injury across natural versus crumb rubber fields, except that abrasions are more severe on the crumb rubber fields.
So twisted ankles, knee injuries.
No systematic differences.
There's a fair amount of urban legend that says there is a significant difference, but the science doesn't support it.
I believe some of the older products, like the AstroTurf that was used in some of the stadium projects back in the 70s, had a much higher rate of like knee injuries and ankle injuries than the newer product, which is more of a squishy surface, which this crumb rubber fields are. That was sort of the information that I remember reading about earlier when we were discussing this in 16. So those fields were overall replaced over the years with these newer fields with more of a soft surface, and there's room for cleats to slide in them. So the problem was in these AstroTurf surfaces, a lot of the football players and baseball players would have issues where when they planted their foot and someone knocked into their foot, there was no slide like there would be in a mud or a dirt surface. And I think that's what's changed a little bit with this crumb rubber surfaces. But the issue that's been coming up that we've been discussing a lot is that these little balls of rubber that are in there, they just sprinkle them on the field. Every, I guess, so many months. Our kids come home with them in their shoes. You get a pile of them in your laundry room. They're everywhere. They're in your clothes. They're on your all your Under Armour stuff attracts them. So the real question is are these toxic or are these have problems? And so far, we haven't found much literature to support that.
And from our discussion in 2016, we know we want children to avoid hand-to-mouth contact while they're playing or right after they've finished playing. We want them to be able to wash their hands. And we did actually suggest that perhaps hand-washing stations be near our athletic fields the last time we looked at this. But this task was to see if we'd found out anything different because we were awaiting this new EPA CDC study, which was promised, and it has not moved. So, yeah, thanks.
Good stuff. Thank you so much for that. Wow. All right. Just a few other announcements that we should be aware of. But December is International AIDS Alliance Month, and World AIDS Day is December 1st. So something that online you can find some interesting information. But it's been December 1st for many years. It's also National Influenza Vaccination Week, the first week of December. So I will remind everyone in the community to get your flu vaccines done. You have plenty of time to get those in. There hasn't been a huge influx of flu cases yet. There's been some. I've seen some in our office, but it has been a harder season for the flu in the south. In Australia, it's been a very rough flu season, so they're predicting that this might be a tougher one this year in the northern hemispheres. I would recommend getting your flu vaccine as soon as possible. It does take about 2 to 3 weeks for you to get immunity, so ideally getting it now would be great for flu season, which is December, January, and February mostly in the Pennsylvania area. Anybody have any other announcements or info, anything else? Anybody? No? Okay. I will just ask one question, Mr. Crowdy, if you don't mind. You had worked a little bit on some traffic issue, the speed limit, or you were talking about the speed limit issue on Bryn Mawr Avenue a few meetings ago, or a couple meetings ago. In general, what's the policy, do you know the policy is on if a resident of the township, and people have approached me, asked me this question, that's why I'm asking you, feel like there's either a road that's either unsafe, the speed is, people are ignoring speed limit signs, or other issues in a road in our township. Is that a township issue, or is that more of a PennDOT issue?
Okay. As far as I know, PennDOT kind of ruled the road. But I found in my instance that talking with Commissioner Nagel was a good way to get things moving. Then I think we got the state reps involved as well. But you know, a direct approach to PennDOT, I'm not sure is going to do you much good. Nagel does seem to have some influence, and then if you can get the state reps involved, that does seem to get some leverage. The speed limit has gone down on South Bryn Mawr Avenue. It was brought. My concern about the apparently unilateral way in which PennDOT decided, or the local police, I think, actually decided to bring the speed limit down from 40 to 35, was the lack of science behind the move. You know, is there any science that says taking it from 40 to 35 takes a drop in fatal accidents of what, 1%, 5%, 90%? There's just no science behind it, and there's just well, if people are upset, if we've had enough people making enough noise, and I'm talking about a handful of people complaining about some of the lunatics that do drive up and down Bryn Mawr Avenue. I live right next to South Bryn Mawr Avenue, so I see it. I see a lot of it. I'm not convinced that I've seen much of a reduction in speed since the speed limit has been brought down. But things have been complicated because they've been working on the bridge at Ithan Creek. That has slowed traffic. So, long-winded way of saying, talk to your commissioner. If you really need to, get your state reps involved. And my experience says that even folks like that are not super keen on having fistfights with PennDOT. Apparently, nobody wins a fight with PennDOT. So,
Well, thank you for that input. I'll relay that message to the folks who have contacted me. Well, seeing that there's no more announcements and there's no public participation today, we will adjourn the meeting and reconvene here on Monday, December the 18th at 5:30 p.m. right here in the Radnor room. Have a great Thanksgiving, everyone.